Okay, let's start off with, how did you decide to get into this career of nursing? What made you decide to do that?
I actually had been told, I was telling people when I was 5 years old that I was going to be a nurse.
So you really were Florence Nightingale early on. No, I don't mean. I'm older than you are. I am older than Joyce. She was one of my heroes.
Don't say anything. I shared a little secret with Ray about Florence. My grandmother's name was Florence. So, and she was not Florence Nightingale. No, I actually think I knew ever since I was, little and in high school. My father was a general practitioner in Chicago, and so I grew up listening to him scream at nurses on the phone, which would make you think, why would I want to be one of them when they had to take such abuse? I guess what I tell the story of, I decided through my father that that's not how I wanted to be. So he was an influence on me in terms of how not to treat people or talk to people.
Yeah.
Anyway, the nurses never knew enough, when you talked to them, etc. So that made me want to get into nursing and make sure I studied hard. And I went to a baccalaureate program. At the university, DePaul University in Chicago. And when I first got out, I was actually, at that time, there weren't very many baccalaureate prepared nurses. And so I took a position on a neuro unit at University of Illinois in Chicago. It's a neurosurgery neurology unit. And within a year after I graduated, I was the head nurse manager.
That was
so quick. Yeah, it was stupid on my part probably, but it was quick. And I liked that. I tried to be innovative. We tried some new nursing techniques. Primary nursing was just coming on the scene and things like that. So I tried to initiate some of those things into the unit. And I did that for several years until the hospital then all of a sudden decided they had to cut the budget. And we got to a place on the unit that I felt was unsafe for patient care, and I was concerned about, I guess I made a statement, when I quit, to say, this is not going in a good direction. I knew I wanted to go back to graduate school and thought I wanted to teach. So then I went back into graduate school.
So you became a leader very, very early in your career. How did you learn to manage people and lead them?
I probably didn't do it all that well. I don't know. I'm trying to think what things, growing up probably helped with that. I think, I had 2 younger sisters, so I was the oldest girl, and I don't know how much that played into it, or, just maybe stupidity, taking on more responsibility than really I should have. But, I got positive feedback from the staff that we were doing things that were different, a little bit innovative. So, I mean, that kind of just fed into that.
Many leaders learn on the job.
Yeah.
So, do you remember any things back then that you would have done differently that you think possibly were a mistake?
Well, I'm not sure I would take that position so soon after graduating. Getting more experience. I had a year as a student nurse, and then a graduate nurse, and then an RN. It was all on the same unit, so the role transition was also difficult because they had seen me as a student and then as a nurse manager. But I think I had their respect. Even as a student, I had respect of the staff, so that certainly helped.
Yeah, we talked about that yesterday. And so, important to, especially to a young leader. They have the respect of the staff. Now, you've got 3 grown children, so you must have had them fairly early in your career. How did you manage having a family and being a nurse?
Oh. Actually, I started graduate school and then found out I was pregnant, and then found out I was pregnant with twins. So, fortunately, my mother lived in Chicago, and she helped a lot. I couldn't have gotten through graduate school if it hadn't been for her help and assistance. And I think, as many families do, their father, my husband, worked opposite shifts, so we tried to minimize the amount of daycare that they had, so we worked opposite shifts. But, you know, just like in Japanese culture, I think a lot of the burden, whether you work full-time as a woman or not, still falls on the woman for raising children. So it was not an easy time. And then I was a single mom when I divorced, and for many, many years, single mom. And the reason I didn't go back for a PhD until later was because my daughter finally got into her last year of high school, and I felt, okay, now I can go back to school. I didn't have to be a full-time worker and full-time mom.
Right. I want to say something about this issue of women having 2 full-time jobs, because certainly we find at M.D.Anderson, amongst the faculty, that the women faculty, even those who have nannies, are still having 2 full-time jobs. They've got their faculty position, and then they're running the household. And this is one of the key things that drives women faculty to retire earlier than the men faculty do, because they're just tired. So let's move on in your career. What have been some of the most difficult things you've had to learn? Like, for instance, I thought the way you handled the conversation with Dr. Feig yesterday was masterful. It takes a lot of experience to get to that place where you feel comfortable and in having those interactions. How did you get there?
I think, experience. I mean, if you go back to my father, you know, listening to that and thinking about, now, if I was on the other end of the phone, how would I respond to that, you know, it wouldn't be tolerated now as much. So I think there's been some movement in hospitals, in in HR departments, we're less tolerant of bad behavior than we used to be. But I think being direct, in my master's program, I took communication, I took ethics, and I took a lot of things. Actually, there was one course that stands out in my graduate program that really helped in terms of getting some confidence in confronting people who were angry or people who were behaving badly.
That's interesting. What was that course?
It was a graduate level communication class. I don't remember the exact name of it, but it was a course not dissimilar to what we're doing, here. But that really helped me be much more assertive and not be afraid to push up against.
So you did role playing and so on in that class?
We did role playing, and I think just getting the support of my colleagues at M.D.Anderson. I've had to deal with some very difficult patients and very difficult situations with other providers, and I just you feel bad, you feel a pit in your stomach when you have to do it, but you have to just go do it. I mean, you have to know what's right and what's appropriate and do it.